Okay, so uh good day everyone. Today's video is the continuation on our discussion about biostatistics. In this video, we'll be talking about the different types of epidemiological studies. Okay, so as an introduction, when we talk about epidemiological studies, these are crucial way of understanding diseases and health conditions in population. So in short, what we're trying to do or what we're trying to understand in epidemiological studies, how does a certain disease occur and what can be used to prevent or cure that particular disease. So, as stated in this presentation, we will explore the different types of epidemiological studies, their characteristics, their strengths, and even their limitations. Okay, so from simple case reports up to different experimental designs. So, we will examine how researchers gather and analyze data to draw meaningful conclusions about public health. Okay, so when we talk about epidemiology as a researchers, we are interested in measuring or assessing the relationship between exposure of a particular disease as well as the outcome. Okay, so as the very first step, we try to define the hypothesis based on different research questions and then decide the appropriate study design that would best suited to answer each of those research questions. Okay, so um, also in this study or epidemiological studies, as a researcher, we try to conduct studies in order for us to investigate so the particular disease and how would we be able to put a direction on the outcome of our study. Okay, so these study designs can be broadly classified from experimental down to observational based on the approach that you will use to assess whether the exposure and the outcome are associated. Okay, so this is what are we going to work on in our discussion. Okay, so in epidemiological studies, we have actually two types. We have what we call the observational studies as well as the randomized trial or um, experimental. Okay, so in an observation study, okay, as a researcher, you try to examine the effects of a particular intervention or particular risk, a diagnostic test or a treatment without trying to control who is to be exposed on that particular study. So the observation can be a prospective, retrospective, or it could be a current depending on the subtype of an observation. Okay. So in a observation study, we actually have um, different types. Okay. So we have what we call a case report and a case series. So what is a case report? Okay. So a case report, uh, as you can see on the PowerPoint presentation, it's a descriptive type of study, an observational type of study at a individual level. It means one person at a time we're talking about. Okay, so these case studies or case reports can assist us in identifying new topics, which can contribute to new ideas for investigations. Okay, so it can also help find novel or unique issues that can lead to new hypotheses and avenues for research. However, when we talk about case reports, since it's a personal note from the one doing the case report, it is subject to bias and suffer from low scientific rigor or scientific process. Okay, because in a case report, it's up to the writer what he or she will put or write on that particular report. Okay, so there may be some instances that uh, they would neglect other information and put other information. Okay, so there is a personal bias coming from the writer. Okay, now on the other hand, a case series is a collection of different case reports. Okay, of a particular disease. So if it's already in a multiple or by batch, we call it case series already. Okay. So typically, as a healthcare practitioner or a person in the healthcare field and environment, such as hospitals, when we have a series of cases, okay, or multiple cases, it can be a avenue or a way to classify possible theories that can be used for analytical researches. Okay, so as a physician, you can handpick which case would you like to work on in a case series. Okay, so which may also have some biases. So again, the limitations is when we talk about case accounts, case reports, or case series, there are often biases. Okay, because that would depend on who wrote the report. Okay, so there is a lack of methodological scientific rigor. Despite the shortcoming of case notes, case series, it can be useful information or it can be useful to formulate, okay, new theories or discoveries to answer gaps or problems in the clinical world or clinical science. Okay, so this is a case report. Now, if you conduct study on each of this case report or case series, we call it already case study. Okay, so a case study can assist us in identifying new topics. Okay, so it is actually a intensive process of studying a person or a group of people or a unit which is aimed to generalize over several units. So in other words, a case study is a in-depth and systematic process of analyzing um, situations, okay, pertaining to a entity or an entity, an event, or a group to better understand the phenomena that happen. Okay, so it helps the researcher, okay, to have a better insight and understanding different datas in conducting research and narrow down broad topics so that it can produce a manageable questions. Okay, so that is a case study. So another type on a much bigger level or group level is what we call the ecological study. Okay, so if a case report is for a individual or specific person or individual, ecological is a much bigger samples or populations. Okay, so when we talk about ecological studies, datas are in a larger scale comparison which are needed. Okay, so to come up with understanding or information. So the central theory of an ecological research is that it relies on the collective comparison rather than human comparison. So unlike in case study or case series or case report, we compare one case from the other But this in a ecological study, we studied the group as a whole. Okay, so instead of studying individual persons or individual patients, we were studying it collectively. So that's why we call it a group level analysis. Okay, so the data is aggregated, which means that you're just looking at the data at the aggregate stage. Okay, which cannot normally link to a specific person. So when we talk about aggregate in a general approach, okay? So the number of people in the community can vary, or the number of people involved on that may be different from the others or other group, okay? Because as again, in ecological study, we're talking about as a group, as a whole, not as part, okay? So as a unit of study, we can work on with the entire school, entire community, entire barangay, or a certain group of people. Okay, so that is a case or ecological study. Now, the next one are under another type of observation, which is about analytical. Okay, so the first two are descriptive because you're only describing the situation. Okay, whether it's case report, case series, or case study, or even ecological. Now, if you want to analyze something, now under observation studies, we call it analytical. So in a analytical observation, as a researcher, we want to try to establish or find the relationship or association between those who are exposed and the outcome. Okay, so there are different types under analytical depending on the direction of your inquiry. Okay, so if your direction is forward based, looking at the future, what will happen, there is a particular study. But if you're like looking at the origin of the case, where it came from, uh, what's its nature, there is another particular one. Okay, so let's have the first process or the first one. The first one is cross-sectional studies. In a cross-sectional studies, as mentioned, it's just like a snapshot of the population of interest taken at a given point in time. So it means what happened to that particular patients on that certain period of time. Okay, so we call it a snapshot because we evaluate both the exposure and the result at the same time. Let's say you were exposed. What happened after you were exposed to that particular disease? Okay, so in a cross-sectional, as an investigator, you measure the outcome and the expose of that of the participants at the same period of time. Okay, so participants in a cross-section study are just selected based on the exclusion and exclusion criteria set for that particular study. So you have your um, guidelines, who will be the participants of the study, okay, who will be included, who are not included on that study. Okay, so the main point here in a cross-sectional study is that each individuals is assessed only once and there's no follow-up. Okay, so as a result, you can assess the prevalence of the disease or condition in which a cross-section study, but not the incidence rate, both of which requires follow-up questions. So when we talk about prevalence rate or these are the people uh, who are affected. Okay, so they were exposed on that particular study and what would be the outcome. Okay. So that is what we call prevalence process or prevalence. Okay. So uh, so it means that the number of cases in a particular disease, like the number of people who are affected, or the number of people with the same other attribute present during the particular interval in time. Okay, so 100 people are exposed. Who among them will have that particular disease? Who among them will be infected on that particular disease, or who were infected on that particular disease? Okay, so in terms of data collection, we gather data from a vast amount of people. Okay, so the same moment in time could last for days or weeks or even months. Okay, so that is a cross-sectional study design. Another one is the case control. Okay, so in a case control, you compare people with a certain disease, we call it cases, to those people who have similar characteristics or possess um, similar characteristics or similar features, but that doesn't mean that they have the actual um, case or disease itself. Okay, so uh, you select controls based on the eligibility criteria from the same population. Okay. So in a case control, as a researcher, you identify individuals with existing health issues or conditions, we call it cases, then along with the similar group without the condition or the controls, then you compare to identify predictors and outcomes. This particular type of study is helpful to generate a hypothesis that can then be researched. For example, um, 10 people are in a room wherein they have similar conditions like flu-like symptoms. One has a COVID-19, but the others have symptoms like COVID-19, but they don't have COVID-19. So basically, we can pinpoint out the difference between a COVID-19 symptoms to a flu symptoms by comparing what is the difference between the two, or what are the experience of a COVID-19 patient as well as a flu, a person with the flu, since they do have similar features. Okay, so they both have fever, they both experience fatigue, they both cough, uh, and have cold. So we check the difference. Okay, so we would be able to distinguish, okay, based on symptoms. Another one is a cohort study. Okay, so a cohort study enlists samples of healthy adults who are followed up for a period of time to see how they are, how is their well-being. Okay, so they are usually prospect because they begin with an interesting exposure and then track them to see whether uh, that exposure would lead to that particular disease or disorder. Okay, so example, COVID-19. Okay, so you were exposed to a person with COVID-19. Okay, so remember the time that uh, when authorities would verify a person who has COVID-19, they would have a tracking system or tracking list that would follow people who are with the COVID-19 patient. So they would check, they would surveillance them to see whether they would develop COVID-19 after they were exposed or not. Okay, so that's a cohort type of study. So the key principle of a cohort study is that a number of people without disease or outcome of interest are selected to be followed up in a period of time. Okay. Some of them may be exposed on that particular disease and some are unexposed. So by the end of the study period, some individuals will have or will develop the disease or outcome of interest on both exposed or unexposed. Okay. So this type of observational study can help us know the cause and effect. Okay. So another process of cohort is, aside from observing those who are exposed, you would also observe who among those unexposed patients would develop the particular disease. Okay, so you're studying both the exposed and unexposed. Okay, so it's a matter of how fast the virus or the disease would spread. Okay, so initially in a cohort study, we classified two group of people, okay, on their exposure status. So the exposed and the non-exposed group. So in a cohort study, it can be retrospective or backdated or prospective forward process. You record the number of people who were who developed the disease under exposed and unexposed, and then you compare. Okay, so we have the computation for that, which is what we call the relative risk, or the measure on the effects of a cohort study. Okay, so a cohort study is a subject to very low recall bias and can have a multiple outcome based on the study simultaneously. If you conduct the study simultaneously, then you can have multiple outcomes. Okay, so the disadvantage of a cohort study is that they are more prone to selection bias. Okay, so studying rare diseases and outcomes have a long follow-up periods. So cohort studies not that kind of good if the studies or the disease is rare. Okay, because it can have a long follow-up as well as it's time consuming. So it may take years or decades because since the disease is there, you would have a hard time looking for patients who develop that particular disease or rare disease. Okay, so these are uh, cohorts. Okay, so participant selection, some of them are exposed to the disease or to the exposure under study, and the other one are not. So there is a follow-up on a period of time. So by the end of the study, some people will have developed a particular disease and some would not. Okay. So the next two are under experimental or randomized trial. So when we talk about randomized trial or experimental studies, these are also known as interventional studies. It means that you try to manipulate who will be receiving the treatment or intervention, and you have a control group or the one that will not be exposed to the treatment or intervention. So basically, you are um, introducing a new treatment or a intervention or a program. Unlike in a observation study, you just simply observe what will happen to the patient if they will be exposed or not, uh, the origin of the disease. So in a randomized, sometimes we check the effectivity of the vaccines or the medicines that we develop based on the observation that we have. Okay, so there are two types of randomized or experimental. The first one is the quasi-experimental. So a quasi-experimental study are generally used to establish the causality, the cause and effect, okay, in situations where researchers are not able to randomly assign the subject to group or various reasons. Okay, so it's a quasi-experimental wherein um, you don't have the element of randomness. It means that you selected your participants, okay, who will be part of your study. So usually this is a uh, small scale process, okay, like for a certain community. Example, a certain barangay in Pampanga or in uh, Bacolor have a dengue outbreak. Then the government would look for some interventions like fogging and check if fogging is effective. It would reduce the dengue cases, like dengue vaccines to prevent the dengue spread. Okay, so it's a specific on a particular community or a particular group of people. Okay, so in a quasi-experimental, uh, these are designs when full experimental control is not possible or practical. Okay, so the limitation is that there is a less internal validity compared to a true experimental. Okay, so in a quasi-experimental, you can have uh, different designs. Interrupted time series design, design with control groups, and design without control groups. Okay, so this highlights that, for example, study about healthcare epidemiology and antimicrobial stewardship. Okay, so you would look for an approach wherein you would avoid selection bias, and as well as you have a common pitfalls of the quasi-experimental study. Okay, so it means, in short, you have control. Okay, uh, which will be your participants. Okay, based on the disease that you're trying to understand. Okay, so in a much bigger level, we have what we call the experimental or true experimental. So as a true experimental study is a scientific approach to which researcher will have one or more variables that they can manipulate and apply to one or more dependent variables. Okay, to measure the effect of that variables on the latter part. Okay, so basically, when we talk about experimental epidemiological study, is you confirm the cause and effect relationship of the factors that you observe on your observational studies. Okay, so you can have variable manipulation, wherein you want to check the effects of the independent variable to the dependent variable. Okay, so by observing it and recording, okay, for a period of time. Okay, so once you do that, this would be able to help you make a reasonable conclusion about the relationship between the independent and the dependent variable. No, so you can have a controlled environment. No, so basically, it takes place on laboratories that have controlled environment, like you set the temperature, the lighting, the surroundings, to minimize the influence of these external variables. Okay, as or to minimize the effects of the uncontrollable variables. Okay, so in a um, experimental study, it can have randomized control trials, which are usually often used for new medicines or new drugs. You can also have field trials. You conduct it considering there is a high risk of conducting a disease, or a community trial wherein you research on social originating disease. Okay, so in short, experimental studies are the methods that are being employed are prospective population experiments. Okay, so the study is designed to test epidemiological hypotheses and usually attempt to relate the postulate causes to the observed effects. So trials of new medicines, like what we had during COVID-19. There have clinical trials about the COVID-19 vaccines that were developed. So it started with a quasi-experimental, wherein they tested the vaccine on a particular group of people who have um, or who does not have COVID-19. And then it became bigger and bigger and bigger until such time that uh, the vaccine will roll out and deemed effective in preventing the spread of the COVID-19 virus or COVID-19. Okay, so experimental and quasi-experimental are very tedious. Okay, and has a long process. So in short, um, when we talk about epidemiological studies, okay, so we have descriptives, case control, and case series, which provides initial insights and can be used to generate hypotheses. We also have observational studies, or under observational analytical. We have cross-sectional, case control, and cohort, which offers us a strong or robust method of examining association. Then we have experimental studies such as quasi-experimental and true experimental design, which provides strongest evidence of cause and effect relationship. And finally, with these types of experiments, we can have a continuous advancement to understand health and diseases, with ongoing refinement of different methodologies. Okay, so in short, with this different studies that we have, we would be able to understand different diseases, and as well as how can we cure and prevent those diseases. in relation with the advancement of technology. Okay, so as we discover new things, new informations, then we advance to look for answers on new informations or new questions that may arise. Okay, so again, so these are the epidemiological studies that you can uh, work on, okay, or that you can use on when you conduct researches. So that's it for today, and thank you so much.